I am Dr. Yogesh Chaudhari, consultant orthopedic surgeon. I started my journey as an orthopedic surgeon with Wockhardt Hospitals, Nashik from 2008. Knee arthritis is a very crippling disease of the elderly, involving 60% of the population. Knee replacement proves a boon for these people where they get back on their feet and become pain-free and independent again. For successful joint replacement surgery, state-of-art medical facilities is a must in today's scenario. All these high-end requirements are available at Advanced Orthopedic Center, Wockhardt Hospital, Nashik. With the use of these facilities, we've been successful in completing more than 3,500 joint replacement surgeries in last 8 years without a single major complication. Revision knee replacement surgery is a repeat surgery for a failed primary knee replacement surgery to rehabilitate the individual. The number of revision surgeries are on rise today, which can be dealt with only at an advanced orthopedic center. The important reason for a failed primary knee replacement surgery is lack of infrastructure and state-of-art surgical facilities. We at Wockhardt Hospital, Nashik now routinely perform revision surgeries, which again requires state-of-art surgical facilities, expert surgeon and rehabilitation. We currently perform on an average 5 knee revision surgeries per month, which has increased from 1 to 2 knee revision surgeries per month just a year ago.